Atrial fibrillation, often shortened to AFib, is a heart rhythm disorder. It is characterized by an irregular and often rapid heartbeat. This irregularity originates in the heart's upper chambers, known as the atria. Instead of beating effectively, the atria quiver chaotically. This dysfunction can disrupt the heart's ability to pump blood efficiently. AFib significantly increases the risk of serious complications like stroke and heart failure. Early detection and effective management are vital to mitigating these risks. AFib often presents with noticeable symptoms such as heart palpitations, shortness of breath, and fatigue. Understanding the complexities of AFib is crucial for both patients and healthcare providers. Diagnosing atrial fibrillation requires a comprehensive approach, combining a patient's medical history with various diagnostic tools. The journey begins with a thorough clinical evaluation. This evaluation involves a detailed discussion of the patient's symptoms, if any. The doctor will inquire about any history of heart problems and lifestyle habits. A physical examination is an integral part of the diagnostic process. The doctor will listen to the patient's heart with a stethoscope, paying close attention to the rhythm. An electrocardiogram, or ECG, is a cornerstone of AFib diagnosis. This non-invasive test records the heart's electrical activity, providing a visual representation of its rhythm. In some cases, additional tests like an echocardiogram or Holter monitoring may be necessary. Once atrial fibrillation is diagnosed, determining the individual's risk level is paramount. This process, known as risk stratification, guides treatment decisions and helps personalize care. Two widely used scoring systems play a crucial role in this assessment: the CHA2DS2 VASC score and the HAS-BLED score. The CHA2DS2 VASC score estimates the risk of stroke in patients with AFib. This score considers factors like age, sex, history of stroke, high blood pressure, and diabetes. Higher scores indicate a higher risk, prompting considerations for anticoagulation therapy. The HAS-BLED score assesses the risk of bleeding in patients taking anticoagulants. This score takes into account factors like high blood pressure, kidney or liver function, and previous stroke. High scores warrant caution and close monitoring during anticoagulation therapy. These tools allow healthcare providers to tailor treatment plans to individual needs. Managing atrial fibrillation effectively requires a multifaceted approach that addresses both the irregular heart rhythm and the underlying factors contributing to the condition. Treatment strategies typically encompass rate control, rhythm control, and anticoagulation. Rate control focuses on slowing down the rapid heart rate associated with AFib. Medications like beta blockers and calcium channel blockers are commonly used. Rhythm control aims to restore and maintain a normal heart rhythm through medications, electrical cardioversion, or catheter ablation. Antiarrhythmic drugs help suppress the abnormal electrical signals that cause AFib. Anticoagulation therapy plays a crucial role in preventing stroke in patients with AFib. By thinning the blood, anticoagulants reduce the risk of blood clots forming in the atria. Direct oral anticoagulants, or DOACs, offer a convenient alternative to traditional anticoagulants like warfarin. The choice of anticoagulant depends on individual patient factors and preferences. Anticoagulation therapy is a cornerstone of stroke prevention in patients with atrial fibrillation. However, it involves a delicate balance between minimizing stroke risk and managing the risk of bleeding. Warfarin, a traditional anticoagulant, has been the mainstay of stroke prevention in AFib for decades. While effective, it requires regular blood monitoring to ensure the dosage is within the therapeutic range. Direct oral anticoagulants, or DOACs, have gained popularity as an alternative to warfarin. These medications, including apixaban, rivaroxaban, dabigatran, and edoxaban, offer several advantages. They do not require routine blood monitoring and have fewer drug interactions. The choice between warfarin and DOACs depends on various factors. Warfarin may be preferred in certain situations, such as in patients with mechanical heart valves. The decision to initiate anticoagulation therapy should be made in consultation with a healthcare professional. The recent BRAIN-F trial has provided valuable insights into the use of anticoagulants in a specific patient population with atrial fibrillation. This randomized clinical trial investigated the impact of rivaroxaban, a DOAC, on cognitive function in adults aged 50 to 80 with AFib and no history of stroke. The trial's findings challenged the notion that anticoagulation might provide cognitive benefits in patients with AFib who are not at high risk for stroke. The study revealed that rivaroxaban did not demonstrate a statistically significant reduction in cognitive decline compared to placebo. This outcome suggests that anticoagulation therapy may not be beneficial for preserving cognitive function in low-risk individuals. These findings have implications for current anticoagulation guidelines. They reinforce the importance of individualizing treatment decisions based on a patient's specific risk factors. While anticoagulation remains crucial for stroke prevention in high-risk individuals, the BRAINF trial emphasizes the need to carefully weigh the benefits and risks in those at lower risk. The trial's results underscore the evolving landscape of AFib management. Managing atrial fibrillation requires careful consideration of individual patient characteristics, as certain groups may have unique needs and considerations. Elderly patients, pregnant women, and individuals who have undergone surgery represent populations that warrant special attention. Elderly patients often present with multiple comorbidities, increasing the complexity of AFib management. The presence of other health conditions may influence both the choice and dosage of medications. Additionally, age-related changes in kidney and liver function can affect drug metabolism and clearance. Pregnancy presents unique challenges in managing AFib, as treatment decisions must prioritize both maternal and fetal well-being. The use of certain medications, particularly some antiarrhythmic drugs and warfarin, is contraindicated during pregnancy. Post-surgical patients, especially those who have undergone cardiac surgery, are at an increased risk of developing AFib. Short-term rate control and rhythm control strategies are typically employed to manage AFib after surgery. Decisions regarding anticoagulation therapy in the post-operative period depend on the type of surgery and the patient's individual risk factors. The ever-evolving understanding of atrial fibrillation and its management has led to continuous updates in clinical practice guidelines. These guidelines, based on the latest scientific evidence, provide healthcare providers with recommendations for diagnosing, treating, and managing AFib effectively. Recent updates reflect advancements in diagnostic tools, treatment modalities, and risk stratification strategies. One notable guideline update pertains to the use of left atrial appendage occlusion, or LAAO, as a stroke prevention strategy. LAAO procedures aim to seal off the left atrial appendage, a small sac-like structure in the heart where blood clots commonly form in patients with AFib. By occluding this appendage, the risk of stroke can be significantly reduced. Recent guidelines recommend LAO as an alternative to long-term anticoagulation therapy in patients with non-valvular AFib who are at high risk of stroke. Another update emphasizes the role of early rhythm control in selected patients with AFib. Emerging evidence suggests that early rhythm control may be beneficial in improving symptoms and reducing the risk of AFib progression. These updates emphasize the importance of personalized medicine, tailoring treatment strategies to individual patient characteristics and preferences. As we navigate the complexities of atrial fibrillation, one thing remains clear. The future of AFib management lies in personalized care and continuous scientific exploration. While significant strides have been made in understanding this prevalent heart rhythm disorder, ongoing research holds the key to unlocking more effective treatments. Personalized medicine, tailoring treatment strategies to individual patient characteristics, is paramount in optimizing AFib management. Factors such as age, comorbidities, genetic predispositions, and lifestyle choices all play a role in shaping an individual's response to treatment. Emerging technologies such as genetic testing and artificial intelligence hold promise in identifying patients who may benefit from specific therapies. Ongoing research is crucial to unraveling the intricate mechanisms underlying AFib. Clinical trials investigating novel drug therapies, innovative ablation techniques, and advanced cardiac devices are continuously pushing the boundaries of AFib treatment. The journey toward conquering AFib requires collaboration among healthcare providers, researchers, patients, and advocacy groups. By fostering open communication and supporting scientific advancements, we can pave the way for a future where AFib is effectively managed. Don't forget to like, share, and subscribe for more updates on AFib management and research.